Welcome to the Skeletal Muscle Anatomy PowerPoint. This PowerPoint is specifically about skeletal muscle anatomy, naming the muscles, naming and identifying a few of their origins and insertions, and talking about a few of the functions of some of these muscles. So, muscles come in three different flavors, basically. You have skeletal muscle, cardiac muscle, and smooth muscle. This whole PowerPoint is focused on skeletal muscle. Skeletal muscles are muscles that are attached to bones, and they're attached to bones with connective tissue called ligaments and tendons. Ligaments attach the bone to bone, while tendons specifically attach muscle to bone. Tendons are made of collagen predominantly. Now, these skeletal muscles, which are attached to tendons, and those are which attach to bones, have two sites of attachment at the least. They have one site called the origin and the other site called the insertion. The origin is where a skeletal muscle attaches to an immovable bone. So this is the bone that's not actually moving when that muscle contracts and relaxes. The insertion is the part of the muscle that's attached to the movable bone. This is the bone that actually moves during a contraction cycle of that particular muscle. So if you see this illustration here, you see a few of the muscles of the neck, and you see that all these muscles have one, two sites of attachment, or one and second site of attachment there. When muscles contract, their basic function is to get shorter or to stretch and get longer and to move bones closer or further away from each other. So in this example, you have the muscles of the neck. This is the insertion. And if you can tell, since we've talked about bones already, it's inserting right over here. See that? That is the mastoid process of the skull. The origin of this muscle is attaching to the clavicle and the manubrium here. So like we said, the origin is the immovable region. So these bones don't move. The insertion is on the movable bone. So when this muscle contracts, this bone moves down closer to here. Essentially, when you contract this muscle, you're bringing your chin and your maybe your lateral ear side where the mastoid process is closer down to your chest or to your shoulder. Now, when we name skeletal muscles, there are a few features that are going to help you with the nomenclature. Number one is the location of the muscle. Example is the brachialis is a muscle that's located on the arm. But as you learned in the first body orientation PowerPoint, we don't call it the arm, we call it the brachial region. So your arm is considered your brachial region, and the muscle that's found in that area is called the brachialis muscle. So oftentimes muscles will be named based on the location that they're found. For example, if you do sit-ups, you're working at your abs. That's the abdominal region. The name of that muscle is called the rectus abdominis. Abdominis, abdominal region. Another way to name muscles is by their shape. The muscle that's found on your shoulder is this shape. We call this a triangle, but we call the muscle a deltoid muscle. Deltoid and delta, this is a delta symbol. So we call it the deltoid muscle because it is triangular. And so shapes and location will both come into play for naming muscles. The size of the muscle is also a big one. For example, there's smaller muscles called minimus, larger muscles called maximus. Great example of these two is the gluteus maximus and the gluteus minimus. They're both found in the gluteal region, but the sizes of the muscles vary. Then we have muscles called longus, which are long muscles. We compare those to shorter muscles we call brevis. Here, I'll write that word down. Brevis. Brevis sounds like brief, and that means short. Longus and brevis muscles, you'll see these in your forearm. The muscles that actually allow you to flex and extend and move your phalanges, those have longus and brevis versions of them. We'll see that towards the end of this PowerPoint. And then you have direction of fascicles and muscle fibers. So muscles can run this way, lengthwise on your body. They can run this way, perpendicular to your body, or they can run this way, diagonal to your body. Muscles running up and down. These are long muscles. An example of this is that rectus abdominis, your abs. Muscles that run perpendicular to that we call transversus abdominis. Transversus, in this case, means it's perpendicular to our rectus abdominis. Diagonal muscles we call oblique muscles. You have oblique muscles in your abdominal region. You also have oblique muscles around your stomach. Those are, again, muscles that are going in a diagonal sense in terms of other muscles that are in that area. And the last thing I want to touch on is the location of the attachment sites. Not just the location of the muscle itself. Like in the brachial region, we had the brachialis. But there are muscles that are straight named based on where they bind to. So the brachioradialis. Let's put a line there. It attaches to the brachial region, which is the humerus, and it attaches to the radialis region, which is the radius. So this is a muscle, if this is your arm, and those are your fingers. And here's a second one. It attaches here to here. Number 6, the number of origins. So I'm going to draw a person here, a stick figure. And here's his head, and here's one arm. I'm going to draw this arm really big, like that. Here's his thumb, and there's his other fingers. Okay, so sometimes muscles attach to more than 2 points. They have multiple origins. So for example, you have the biceps and the triceps. So the biceps are on top and the triceps are on the bottom. Biceps have 2 attachment points for the origin here and here. And the tricep has 3. So let's just draw 1, 2, and we'll do one more, 3. So the names of muscles, if you see bi, tri, your quad muscles, which are on your femoral region, quadriceps have 4 origin sites. Those bi, tri, and quad indicate how many origins there are. And the last thing overall for naming muscles is its action. There are some muscles that are flexors. That means to flex your arm this way. There are muscles that are extenders that extend your arm this way. So if these are your legs and here are your knees, flexing your knee is moving it this way and extending the knee is moving it back out that way. There are some muscles where their function is part of the name. For example, the muscles that help you flex your wrist this way, all the muscles on your forearm are called flexors. The ones behind your forearm that help you extend your wrist are called extensors. For example, there's muscles called flexor carpi radialis or extensor carpi ulnaris. There's adductor muscles that are usually found in this inner femoral region, and they help you adduct your thigh towards your medial line, or there's abductor muscles, which are found on the outside of your thigh that help you abduct your thigh out and open that pelvis up. So the names of muscles, you'll start noticing that they're pretty easy to remember because the names actually tell you where they are and what they do. The sternocleidomastoideus muscle. It's also called the sternocleidomastoid. So that is the name that you'll see on the list that I've given you. The sternocleidomastoid muscle is this guy right here. It's going to be found in your neck. And when you contract it, it's going to flex your head down. And it's also able to rotate your head in both directions. The origin of this muscle is going to be the sternum, which is right over here at the manubrium, and your clavicle. Remember, origin is the immovable bone. The insertion is the mastoid process, which is up there. Now, for your exam, any slide that gives you function, origin, or insertion, that means that you must know them. There are going to be slides where I just give you the muscle name and I show you where it is, and it won't have function, origin, or insertion. Do not worry about finding those for those muscles. You only need to memorize the ones that I've actually given you on the PowerPoint. So for sternocleidomastoid, we've got the function, the origin, and the insertion. The next one is called the masseter. And just as a heads up, you guys, I love this illustration because look at how beautiful it is. You can see all the muscles very clearly on the face and the superficial neck region. You see the muscles on the skull as well. The muscle we're looking at right now is this muscle. Your masseter muscle is one of the strongest muscles that you have in your whole body. Now, a lot of students say, well, what about the muscles of your leg? Well, those muscles are larger in size. If you took all the muscles in your body and compared them by cubic millimeter or cubic inch, the masseter is one of the strongest. The job of the masseter is to elevate your mandible. So let me just draw the outline of the mandible right there. And this masseter comes down here. The origin, the immovable part, is up here at the zygomatic arch. And the insertion is in the movable bone at the mandible down over here. Remember the mandible has like this curve at the bottom of it? It's like your jawline. That's called the ramus of the mandible. That's where it inserts. So when this muscle contracts, it brings your whole mandible up. And it allows you to do chewing. So masseter elevates the mandible, origin is the zygomatic arch, and the insertion is the mandible. Next muscle, same picture. Temporalis. This muscle right over here. The temporalis muscle is found on the temporal bone of the skull, and its job, again, is to elevate and retract the mandible. Now, a lot of students say, what? A muscle on the skull helps you with eating and chewing? Well, do me a favor. Take your hands and put them on both sides of your head, and then start chewing. Do you feel those muscles contracting and relaxing? You should, because the temporalis muscle does have function in elevating and retracting the mandible. I want you to notice that it does have attachments on that zygomatic bone as well. The zygomatic bone, by the way, will always be an origin and not an insertion, because this bone literally doesn't have the function to move. It doesn't even have the ability. It's connected to your skull, and we know that the skull does not have any moving joints in it. So that is the temporalis. I did not give you origin and insertion for this, so don't worry about knowing it. I do want to point out these three muscles here. Orbicularis oculi. The word orbicularis means circle. Oculi means eye. Oris means mouth. Orbicularis oculi, circle around the eye. Orbicularis oris, circle around the mouth. This is the orbicularis oculi. This is the orbicularis oris. The other one I want you to know is the zygomaticus muscle. This one here and this one here. This one is called the zygomaticus minor. This is called the zygomaticus major. You can probably guess why. This one's smaller, that one's bigger. Okay? So this illustration, love, love, love this picture. Okay, going to the posterior of the body, we're going to start with the trapezius, and it's called the trapezius because it's a trapezoid shape, and it starts all the way up there. It comes and binds, you see here, that is the spine of the scapula. It shows it on this side too. This is a deeper image. This is a more superficial image. So the trapezius binds to the back of the skull. It binds to the spine of the scapula, and look at that, all along the vertebrae. The job of this muscle is to extend your head, adduct, elevate, or depress the scapula. So if you contract this muscle up here, you can bring that scapula up. It's almost like you're shrugging your shoulders up. If you contract the bottom part, you can pull those shoulders back down. When I say pull the shoulders up and down, it means to elevate and depress your scapula. Again, I have not listed an origin and insertion, but I do like to point them out to you so you can see exactly where that muscle goes in your body. Now, below that muscle, you have a really big one called the latissimus dorsi. And I have given you an origin and insertion for this. The origin is going to be the vertebrae. So it's going to be underneath this muscle. It attaches to the vertebrae going all the way down. And what you don't see on this picture is that this muscle goes so low that it also attaches and binds to another origin called the ilium. That's all the way down in your pelvis. Its insertion is going to be beneath this muscle on the deltoid. Sorry, not on the deltoid, underneath the deltoid on the humerus. So if the humerus is the bone that's underneath here, the latissimus dorsi comes and binds to that humerus bone. So if you relax the latissimus dorsi, you can bring your arms forward medially. If you contract the latissimus dorsi, you can open your arms back out laterally away from your body. The deltoid muscle is next. And the deltoid muscle, they are your muscles that are on your shoulders. They are the most superficial muscles you have. And the deltoid muscle actually inserts into the humerus at that ridge we talked about. You see this ridge right here? Called the deltoid tuberosity. That's its insertion. Its origin is going to be the scapula and the clavicle. So in the back here, you notice how it binds to the scapula right here. And the anterior portion of this muscle, which we can't see, will go into the front and bind to the clavicle. So the purpose of this muscle is to abduct the arm, which means move it upward that way, up towards the sky, and to flex and extend the arm. When this deltoid contracts, it pulls this arm up alongside it. I'd like you to know, though, that these functions are functions of these muscles, but it's not just this muscle that works alone to move this arm up. It is just the major one that I'm giving you. All right. Before I get to the pectoralis major, I'd like to show you the deltoid again. The anterior side, notice how it's here with the origin at the clavicle. That's what the last slide said. So this slide shows you the pectoralis major. That's going to be this muscle here. And this whole muscle is the pec major, and it has an origin at both the sternum, here, and the clavicle, there. Its insertion is going to be up here, the greater tubercle of the humerus. And if I may, with a different color, attempt to draw the humerus bone. We'll do the head of the humerus here. We'll do the greater tubercle here. We've got the deltoid, and then we're going down this way, and the lesser tubercle there. This pectoralis major muscle comes up and binds up here to that greater tubercle of the humerus. It's that ridge behind the head. And its job is to flex, to adduct, and rotate the arms medially. So if you're holding your arms out to the side, rotating them medially is bringing them from your outsides, from your left and right, bringing them in towards the middle in front of your face. That would be your pectoralis major muscle function. Now we get to the biceps brachii. It has the prefix bi in front of it. And we learned that that meant two origins. So if you look at the biceps brachii, it has two origins because it has a long head and it has a short head. They both will attach to the coracoid process of the scapula right there and inside the glenoid cavity of the scapula. So two origins, which is why we call this muscle the biceps brachii. The insertion is at the radial tuberosity. So if you see here, there's the radial head right there. The radial tuberosity is this ridge right there. So they go and bind into the radial tuberosity. They can wrap around the ulna, but they bind into the radial tuberosity. The job of the biceps brachii is to flex your elbow. And then behind it is the triceps brachii. The triceps brachii has three origins. There's going to be two behind the humerus, which is going to be these ones right here. And then there's one that kind of detours off and binds to the scapula. Its insertion is at the olecranon. Literally the same structure that we saw on the ulna in the last PowerPoint. It is the tip of your elbow. So if you're feeling your elbow, that hard tip, that is your olecranon. And that is where your tricep muscle actually binds to insert. So when you flex and extend your elbow, you're moving your triceps and your biceps. So the triceps help you to extend the elbow. The biceps help you to flex the elbow. Now, this is the slide that I love as well. I do love putting this on lab exams because look at how perfectly they've shown you the depth of the abdominal region. This muscle going up and down, that is called the rectus abdominis. The one going left and right here, that is the transverse abdominis. The outside one going diagonal is the external oblique. The inside diagonal is the internal oblique. You will see these labeled in just a moment. This slide specifically tells you about the rectus abdominis and how its job is to flex your abdomen. And it has an origin at the pubis down here. And it inserts up here at the xiphoid process, as well as at the cartilage of your ribs. So when you're doing sit-ups, really you're moving that towards that. This is the movable region, henceforth the insertion. This is the immovable region, and we call that the origin. So now labeling the ones that we just talked about. External oblique. Inside is the internal oblique. And on the topic of external and internal, you also have external and internal intercostals. Inter means in between. You guys now know that costal means ribs. So in between ribs. The external intercostals are going to be found moving from the outside towards the medial side. And those guys are there to elevate your ribs. They pull your ribs up. And when you pull your rib cage up, I want you to write down here, inhale. When you contract the external intercostals, you elevate your ribs. You open up your rib cage. That helps you inhale. The internal intercostal starts medial and moves out lateral. This depresses your ribs, and I want you to write exhale. So these intercostal muscles, one of their big jobs is respiration. Breathe in, breathe out. Open up ribs, close ribs. Another muscle that helps with breathing is called the diaphragm muscle. This is an inferior view, so you're looking from the bottom up of a diaphragm muscle. So this would be like someone's laying on their backs, their head is pointing away from you, their legs are pointing towards you, and you're looking from bottom up. This diaphragm muscle contracts and relaxes to help you breathe in and out as well. The contraction of the diaphragm, and if I may draw a thoracic cavity here, here are the person's arms, here's their head. Your diaphragm muscle, normally at rest, it looks like that. But when you breathe in, it contracts down. So your diaphragm muscle flattens out. And when that diaphragm comes down, contracts, and flattens out, it opens up the space inside your thoracic cavity. And it allows you to inhale. So again, when your diaphragm contracts, it goes from that position down to a flat position. And then again, the opposite will happen when you're ready to exhale. This diaphragm will relax back up into a curved structure, and that pushes back up on your lungs to help you exhale air. Now moving our way down, we're going to go to the leg. This is a right side leg from a posterior view. So this is the gluteal region, the butt. This is behind the knee right here. The gluteus maximus is this one, the largest gluteal muscle that we have. It is there to extend and rotate your thigh laterally. So if you were to take yourself from standing in a proper anatomical position, so toes pointed forward, and you took your toes and you started moving them out laterally to the right side and the left side, you're going to slowly start moving your toes, your knee, and your thigh, and you're opening up your pelvis. And that really is what is moving your thigh laterally. Contraction of the gluteus maximus does lateral rotation. The origins are the ilium, the sacrum, and the coccyx up here. And the insertion is the gluteal tuberosity of the femur, which is down at the bottom. So if you follow this, it's going to come down anteriorly and it's going to be at the femur. The next muscle that we're going to go over today is the rectus femoris. So the rectus femoris is the first muscle I'm introducing that has to do with the femoral region, which is this whole region right here. As you can see, there's several muscles. I'm going to underline all the ones that I know are on your list, just so you kind of see how much you're going to have to learn and focus on. The labels on this picture aren't that great by any means, but just so you can see, like we have the gracilis muscle, the adductor longus, and then you have the adductor longus as well. These two are adductors. This one is the main longus muscle. We call this one the adductor magnus. There's the pectineus, and then I'll underline this one, the iliopsoas, tensor fascia latae. You have the rectus femoris. This is the one that's on this slide. The sartorius that comes diagonal like a sword. The vastus lateralis because it's more lateral, and the vastus medialis because it's more medial. These are all of the muscles that are going to be on your list for femoral region. These guys are all going to be found on the anterior thigh, and their job is to flex the thigh and extend the lower leg. So if you're sitting in a chair right now and you extend your lower leg up, so you extend that knee joint, you'll notice that the muscles that are in this region are the ones contracting to pull that lower leg up. But for the rectus femoris specifically, I've given you an origin and an insertion. The origin is going to be at the ilium. So if you follow this muscle up, and if I were to peel these two muscles away, you'd notice that it would come up here and bind to the ilium bone. At the more distal side, the insertion is here at the patella and the tibial tuberosity. So it goes past the patella down to the tibial tuberosity. If you recall, that tibial tuberosity was a ridge that was right over here. So the contraction of this guy pulls your lower leg up. Same picture, but now focusing on the gracilis muscle. When this muscle contracts, it's able to adduct and flex your thigh. So if your thigh, here's my stick figure. If your thigh was out here, it's going to adduct it and it can bring it down towards your medial line. That is the job of the gracilis, the adductor magnus, and the adductor longus muscles. Most superficial, this long one diagonal is called the sartorius. Think of it as like the sword. So the sartorius, the sword. It's a really long muscle, pretty thin, and it goes across from the lateral femoral side to the medial femoral side. The job of this muscle is to flex your thigh and rotate it laterally. So again, here's my stick figure. I think these work pretty well. So if I'm going to rotate the thigh laterally or flex it, flexing it means to bring it up like this, and now I'm higher up, or rotate it laterally, so rotate it that way. You can actually see both points here. The origin is going to be right here at the iliac spine, and the insertion is going to be at the proximal tibia. Proximal tibia means it's just going to come all the way down, and when it gets to the tibia, it's going to bind to the top of the tibia. And that is your sartorius. Now we're going to turn the muscle to the back, and we're going to look at the biceps femoris. So again, if we look at this side, it is the right side anterior. This is the right side posterior, so his other leg would come down this way. We talked about the gluteus maximus. The gluteus medius is underneath that, and the gluteus minimus is going to be a small muscle underneath both of those. You can't see it on this picture though. You can see the gracilis muscle from the posterior side. You do see the posterior of the adductor magnus on this side as well. But the ones that we're really looking at is this one, and that one. On this slide, we're talking about the biceps femoris. And the biceps femoris is the larger muscle that we have on the posterior side of the femoral region. And the biceps femoris is right here. Its origin is going to be at the ischial tuberosity. So it goes up, 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 up behind the gluteal muscle, and it binds to a ridge that we've previously identified on our bones lecture. And all the way at the bottom, it has 2 insertion points. So we call it biceps femoris. The insertion points are both the tibia and the fibula. And if we look at the lower leg, your calf muscle has a proper name called the gastrocnemius. It's spelled gastrocnemius, but it is pronounced gastrocnemius. The gastrocnemius is there for taking your foot and pointing it down. We call that plantar flexion. And also for flexing your lower leg, for moving that leg that way. Its origin is the distal end of the femur. So the femur is up here. It binds here. And the calcaneus bone of the foot, which is here. So this huge tendon is going to come down and bind at the calcaneus of the foot. So this is your gastrocnemius. I do want you to notice that I'm not going over every single muscle's origin and insertion, or even their names, because this PowerPoint is for your lecture exam, and I'm only covering specific ones and their functions for the lecture exam. The lab exam does have its own list, and you will be identifying every muscle that I've circled for that lab exam. The lab exam is going to use illustrations that come from cadavers and cartoons, and you do have a file for that as well. So just know that I'm not forgetting to show you these. It's just that that's not part of your lecture exam material. For lab time, we will be going over and doing some labeling together because I think that's really helpful. But for this one, just know that I've chosen select muscles to go over with you. So that was the gastrocnemius here. Jumping to the front, the tibialis anterior. The name tells you the location. It's on the tibia bone, and it's on the anterior of your foot. And the job of this guy is to dorsiflex the foot, so pointing the toes up. It is also there to invert the foot. That means pointing the sole of your foot inwards towards your medial line. This is the muscle that you actually feel when you touch the front part of your shin. If you feel your shin right now, you'll feel the tibia bone. The bone is very, very close to the skin. But if you feel around that bone, you'll feel kind of soft area, soft region. That's muscle, and that's where your tibialis anterior is going to be. Muscles of the forearms, posterior and anterior, are going to be on both sides, and they're pretty close together. So differentiating them can be a bit tricky. I have given you a list of the flexors and the extenders. So here's my stick figure, and here's his arm, and let's say this is his forearm. Okay, so that's the elbow here, and that's the elbow there. And then here is his thumb with fingers. And I have to draw this because I'm trying to show you flexion versus extension. So when you take the palm of your hand and you bend it this way, it is called flexion. When you move it this way, it is called extension. So I'm going to label that with an F, and I'm going to label that with an E. So flexion is when you are bringing your fingers and palm towards the muscles of your inner forearm. And extension is when you're flexing them away, and now you're moving your knuckles towards the back of your forearm. If you could just take a moment and try that right now, I want you to see which muscles are contracting when you move your wrists back and forth. So flex your wrist and notice that the muscles that are on the anterior of your forearm contract. And when you extend your wrist, the muscles on the posterior of your forearm contract. All the muscles on the anterior side are called flexors. There are 4 main flexors I'd like you to know, and we're going to go over all 4 of them on the illustration in a moment. The smallest one that's kind of in a weird place is the pronator teres, and I'll show you that one. The rest of the 3 run lengthwise along your forearm. So let me go ahead and box up the ones we're doing. And that one. Okay. These ones are easy to memorize because the words literally tell you where the muscle is. So they're flexors, so we know they're on the anterior side of the forearm, where the palm of your wrist is. Carpi means they run over the carpal region, so they extend all the way to your fingers. So these are going to be muscles that run all the way up, and they connect to your fingers to help with flexion and extension of those as well. And then ulnaris and radialis for these 2 tell you where they're located. So flexor carpi ulnaris, it's on the flexor side, and it's over the ulna bone. As you know, the one that connects to the thumb is the radius. The one that's on the pinky side is the ulna. So it is this muscle here, flexor carpi ulnaris. And then we've got the flexor carpi radialis. And in between those 2, you have this really long muscle that goes to the palm of your hand. And that's called the palmaris longus. So it's goes to the palm and it's very long. On the cadaver, it's a little bit more difficult to differentiate because there's not clear-cut cartoon lines, but you can see that you've got the flexor carpi radialis here running up. There's the tendon for it right there. Flexor carpi ulnaris here. And the palmaris longus, you see this little muscle here, but you see that really long tendon? My marker is going over it. It's really long all the way up. So those are the 3 that run parallel. There's a small one here called the pronator teres. And the pronator teres helps you rotate your radius and ulna as well as your wrist to go from a supine to a prone position. So from palms facing down, rotating to palms facing up, that is what the pronator teres does. It does pronation. So moving those palms to a prone position. I will be using both illustrations on that lab practical. So be sure to look at both of these. And the second part of this I'm going to get to is the extensors part. The extensors, there are 5 of them. And these ones are pretty similar to the last ones where it says extensor. So it's going to be on the extensor side, the back of your forearm. And it gives you where it's located in terms of bones, radial region or the carpal region. So let's look at these bones. This cadaver illustration is much, much better. Sorry, not illustration, the photo. It's much more distinct. It's much more cleaned up. So I really do like this cadaver picture. Now, let's box up our words. And that one. Okay, let's start with brachioradialis. This is one of the muscles that we went over when we talked about naming muscles. The brachioradialis starts at the brachial region and extends down to the radial region. So it's going to kind of go across. It's this muscle right over here. Brachioradialis goes all the way across there, and you see it there. Next to that one is going to be our extensor carpi radialis, brevis, and longus. Brevis is shorter, longus is longer, just like the name states. The longus is going to start from further back, so it would make sense that it's closer to where the brachioradialis begins. So the extensor carpi radialis is here, and then the extensor carpi radialis brevis is right next to it. So again, here, extensor carpi radialis longus, extensor carpi radialis brevis. Next to that, you have what's called the extensor digitorum. It extends the digits. It might help to start from the digits then and follow that tendon down to the muscle right there. Next to that, extensor carpi ulnaris. I do want you to notice that all three of these muscles have the same tendon and the same origin right over here. But they do branch off and they become three different muscles. This right here is the back side of the flexor carpi ulnaris. So don't get confused and name this as the extensor. Just know that from this view, you can see one of your flexor muscles. So if we look on the cadaver, you have the extensor carpi digitorum, and it's going to go all the way up to the digits. And next to that, you have your extensor carpi ulnaris, and that's going to be this guy coming down this way. So both pictures are great. I do like this cadaver image, but don't forget to look at the file of images. Okay, so next section and chunk of muscles is going to be a bit of a review, but some of them are going to be new. This is the illustration that I would be using, just so you know. It is much better than the last one, and it's much more clear, and it does show you almost every muscle that's on the list. So we have the adductor longus and the adductor brevis. Adductor longus is right over here. Behind that, as we already saw, you have the adductor magnus. The pectineus muscle is next to that. The gracilis muscle is next to that. And then right here is the iliopsoas muscle. It's that whole thing. Now, if I were you, I've mentioned before, if there are muscles or bones or any kind of feature that comes in order, learn them in order. So I'm going to erase these, and I'm going to number these how I think you should learn them. So 1, 2, 3, 4, and 5, because it goes medial to lateral. Gracilis, adductor magnus, adductor longus, pectineus, and iliopsoas. You can't see the adductor brevis on this picture, but you will be able to see it using visible body. Or if you want to just look up another illustration, you'll be able to see it there. So learn them from medial to lateral. And then again from medial to lateral, I'm going to just number these one more time. Sartorius is this one. Then I would jump to vastus medialis. then rectus femoris, then vastus lateralis, and the most lateral one, tensor fasciae latae. So 1, 2, 3, 4, 5. Those will give you the 10 major superficial muscles on the anterior femoral region. It will take practice. You do have to go through it. We are going to be labeling it together. So don't worry. It's kind of like Bones Worth. The more you do it, the faster you'll get it. And these are just the rest of the muscles that I labeled on the last one. The posterior side, again, we're going to go in an order. We'll do from medial to lateral. So the gracilis is visible on the posterior side. So I'm going to just number it. Although it's not part of hamstrings, I'm going to number it because when you see this picture on the lab exam, it is fair game for me to say, hey, what is that muscle name? So we'll number this 1. And then the next one is 2, 3, and 4. So gracilis, semimembranosus, semitendinosus, and biceps femoris. A little trick for remembering these 2 words is that the semimembranosus comes before the semitendinosus. The semimembranosus is more medial than the semitendinosus. Remember, medial is towards your middle line. This is the person's right foot. You have the guy's left foot on this side, and the rest of his sacrum is right there. This is a great photo that shows you all the gluteal muscles, glute max, glute medius, and then if you peel these 2 layers off, underneath is the glute minimus. The piriformis is underneath that, but this is not part of your muscles list. So remember, just go with your muscles list for everything that's going to be on the lab exam.